Hi, welcome to the lung page. Today we are going to see why we are going to put IC tube or intercostal tube for pleural effusion. What are the indication? Why we are going to remove the pleural fluid? Sometimes we are not remove the pleural fluid. So in this case, what are the actual indication for the removal or drainage of the pleural fluid? So we will see the one by one regarding to the latest BTS or ATS guideline, right? So these are the main thing. First, we have to know about empyema. We all know that is called complicated parapneumonic effusion. So following any one of these following is there with a patient present with fever, we suspect there's a parapneumonic effusion, that is complicated parapneumonic effusion. Which of the following, any one of the following is there, we have to put the IC tube then and there to drain the fluid. So antibiotic alone is not enough for this type of patient. So indications are mainly when we drain or when you do the thoracocentesis, we identify there's a frank pus or sometimes positive gram stain or cultures in the thoracocentesis diagnostic type fluid, pleural fluid. Some pleural fluid pH is less than 7.2 and also presented with the pleural fluid glucose level is less than 60. Or sometimes when you do the ultrasound scan, we identify the loculated effusion or CT scan found to have a loculated effusion. So we see this is the ultrasound image of the chest. Uh, this is the diaphragm. This is the lung. This is the complicated and loculated septated effusion. So this type of pleural effusion need IC tube then and there to remove the fluid. So this is one of the indication. Second indication is large symptomatic effusion. If the patient is very symptomatic, so when you see this picture, this patient has more than half of the hemithorax is involved, and also patient is dyspneic. We have to put a IC tube to relieve the symptom of the patient. And also the patient have a malignant effusion for some selected patients only. The patient recurrent pleural effusion is there, recurrent malignant pleural effusion, and also some we have to plan for the chemical pleural disease. So in that type of patient we have to put a IC tube or indwelling pleural catheter. Another important thing is hemothorax. So we all know how to diagnose hemothorax is when you identify the pleural fluid hematocrit more than 50% of the blood, that is indicated hemothorax. When they identify the hemothorax is there, we have to put the IC tube then and there to prevent the collection of the infection, and also that is prevent the fibrohemithorax. So we have to put an immediate chest tube for these patients. And another important thing is non-expanding lung with a significant effusion, that called trap lung. So when we identify this trap lung in the CT or in the scan, we have to put a IC tube or we have to perform the indwelling pleural catheter for the short term to relieve the symptoms, and also we have to help to expand the lung. So we all know these are the main indication for pleural fluid patients need a IC tube. Okay, stay tuned. We'll do the another interesting topics. Bye.